Hello and welcome to our webinar series, Candid Conversations on Health. Throughout the year, we have and will continue to tackle a variety of topics related to our health and wellness. The focus of today's webinar is National Immunization Awareness Month. This webinar is being done in collaboration between LDH's Bureau of Community Partnerships and Health Equity and the LDH Immunization Program. My name is Ayana Usuri, and I'm the support coordinator for the Bureau of Community Partnerships and Health Equity, also known as BCPHE. BCPHE is devoted to increasing the citizens of Louisiana's knowledge about what affects our health, especially for those in particularly vulnerable communities and populations. This devotion is rooted in raising awareness through webinars like today's and partnering with stakeholders in the community to move forward toward a healthier Louisiana. At this time, it is my honor to introduce Talva Carlisle of the Louisiana Department of Health Immunizations team, who will share a few welcoming words. Mrs. Carlisle?
Good evening, and thank you all so much for joining us tonight. I am Talva Burnett Carlisle. I am one of two vaccine equity coordinators for the Office of Public Health Immunization Program. We are very excited that this webinar is being held in August during National Immunization Awareness Month, and grateful to the Bureau of Community Partnership and Health Equity for hosting this event. I want to thank you all and celebrate you for being here and welcome you all again this evening. The Vaccine Equity Initiative Program aims to promote fair and just vaccination awareness, acceptance, and access for groups that experience disparities in immunization and in health outcomes. The population health impact of COVID has exposed longstanding inequities that have systematically undermined the physical, social, economic, and emotional health of racial and ethnic minority populations and other population groups that are bearing a disproportionate amount of the burden of COVID-19. Equity in immunization, as we know, reduces the risk of vaccine preventable diseases among vulnerable populations and individuals who are at high risk of suffering from disease. It also contributes to health equities in general, and is a powerful tool to reduce and improve school results, future employment, and health. With that, the Office of Public Health and Immunization Department has been doing a number of things to create awareness for the importance of immunization, starting with our in-home vaccination program that offers homebound individuals with disabilities and to their loved ones and caregivers for all Louisiana residents 6 months and above that are homebound or disabled, and they qualify for the service. It's free. The COVID vaccination is free at home via the mobile vaccination team, and I'll go ahead and pop that link in the chat box, as well as there's a link for a flyer that if you need language variations or additional information, I'm happy to share that as well. We have public awareness campaigns going on television and film and billboards, social media that push the idea of routine childhood shots, that they keep our kids healthy, strong, and resilient. We have done several interviews and had important vaccination conversations. Speaking of that, we have our Vax Matter podcast series that the immunization program is putting out. We've released 9 and we have 36 planned in the series over the coming year. The podcast is new. It's released every 2 weeks, and it takes a deep dive into exploring the history, the future of vaccinations, as well as addressing facts, misinformation, disinformation, myths, and all around helping people better understand the value and the benefit of getting themselves and their children vaccinated. Vax Matter can be found at Apple, Google Podcasts, Spotify, Audible, iHeart, and I'll go ahead and add a link for that as well. Our communications team has been working very diligently each week for Facebook posts and Instagram messages, all to reach out to families so that they understand the value of vaccinations and getting themselves and their children vaccinated. I sit here today because of the vaccinations that I took as a child and that I have taken in the last couple of years. So tonight's discussion will continue that effort and allow you to hear from several people who are working daily and very hard to ensure that everyone in Louisiana has an opportunity to get vaccinated against preventable deadly diseases. Again, I thank you so much, and I welcome you thank you for attending and welcome you. And now I will turn it back over to Anya. Thank you.
Thank you so much, Mrs. Carlisle. What a wonderful welcome. And those resources, I've shared it in the chat, but those resources that she mentioned will also be included on our resource guide, which we'll also mention later on. But now we'll go over a brief overview of today's event. So we're gonna do our intro and welcome, which we're doing now. And then we'll go over our facts related to immunizations. We'll have our panel discussion, and then we'll go over those key takeaways once more. So regarding the facts for National Immunization Awareness Month. So the objective of this webinar today is to strengthen our audience's understanding regarding the importance of vaccinations for all ages and to address vaccine hesitancy concerns. So first, vaccinations are recommended based on an individual's age, health conditions, job, or lifestyle. Next, vaccines work with our body's natural defenses to safely develop protection from diseases. They give us the power to protect ourselves and our children from serious diseases such as measles, shingles, whooping cough, the flu, and more. Thanks to the development of vaccines, many serious illnesses and diseases are no longer as common in the United States. However, these diseases still exist and can spread when people aren't vaccinated. They also can cause serious illness and/or hospitalization in some cases. And last but not least, vaccines are safe and tested before they are shared with the community. They're also carefully monitored after being released to continually ensure their safety. These 4 facts are ones you will hear throughout the webinar. I want to stress the importance of getting information from trustworthy sources. So if you are going to share any information related to immunizations with loved ones or within your communities, please only use information coming from websites like the Louisiana Department of Health, the CDC, and the like. We will also provide you with a one-pager resource guide via email after this session today to aid you in how to share this information. Sharing accurate information can help save lives. And now it is my pleasure to introduce the Deputy Director of the Bureau of Community Partnerships and Health Equity, Mia Orr-White.
Thank you, Ms. Ussery, and thank you all for joining our Candid Conversations on Health, National Immunization Awareness Month webinar. Before I turn the session over to our event moderator, I want to thank each and every one of you for joining today's conversation. I hope that you find today's discussion informative and helpful. Here's some helpful information for people with Medicaid insurance. If your medical insurance coverage is for Medicaid, then you must make sure that your information is up to date. This includes your address. If you do not update your information, you may miss important letters from Medicaid and you could lose your health insurance coverage. To update your information, you can visit the website, or I'm sorry, you can visit the self-service portal at www.ldh.la.gov/mymedicaid, or you can call 1-888-342-6207. So without further ado, today's moderator is Dr. Lacey Kavanaugh. Dr. Kavanaugh is a family medicine physician who is a native of Letcher, Louisiana. She graduated from Letcher High School and attended college at Centenary College of Louisiana in Shreveport, where she graduated in 2005 with majors in biochemistry and neuroscience. She then attended Louisiana State University Medical School in New Orleans, where she graduated in 2009 as part of the Rural Scholars Program. She completed her residency training in family medicine from 2009 to 2012 at Lake Charles Memorial Hospital. Dr. Kavanaugh has worked in private solo practice in Sulphur, as well as in the Rural Health Clinic in Vinton. She has also worked at Family Physicians Urgent Care as both a physician and founding partner. Following a passion for prevention and community health, Dr. Kavanaugh joined the Office of Public Health in January 2019 as Regional Medical Director, Regional Administrator of Region 5, which includes Calcasieu, Jefferson Davis, Cameron, Beauregard, and Allen parishes. All right, and with that, let's get ready to have a discussion. Take it away, Dr. Kavanaugh.
Wonderful. Thank you so much to Ms. White, Ms. Carlisle, and Ms. Ussery for starting us off on today's event. For each of you who are here with us today, our community members and our stakeholders who took time out of your very busy schedules to attend this really important discussion, I just want to say thank you. In this webinar, we hope that what you hear are things that you find useful, empowering, and encouraging. We want you and our audience to leave today's conversation with knowledge to understand all of the various aspects and complexities of immunizations. We have some wonderful trusted gatekeepers here from all around the state who will hopefully help to lead us in this discussion. Before we go any further, I want to make sure that we introduce them. So we'll start with a little introduction of our panelists. We have Dr. John Vincherry, who's here with us today. He is a second-generation pediatrician from Lake Charles and is the chief of LSU Health Shreveport Department of Pediatrics Infectious Diseases section. He earned his doctorate from Emory University before completing both residency and fellowship training at Baylor College of Medicine. Dr. Vincherry is also the current president of the Louisiana chapter of the American Academy of Pediatrics. Our next panelist is Ms. Javon Davis, who is the operations manager for the Office of Public Health Immunization Program. She has 15 years of experience with the Office of Public Health, specializing in prevention and treatment of infectious diseases. She is a New Orleans native and is passionate about improving health outcomes for the citizens of Louisiana. Our next panelist is Mr. Brad Batiste. With 22 years of experience in both private and public sectors, Mr. Batiste is a compassionate, dedicated social worker whose experience ranges from group and individual therapy, both within inpatient and outpatient psychiatric facilities in elementary schools, crisis counseling, and suicide prevention intervention. Mr. Batiste received his bachelor's degree in social work from Southern University A&M College and his master's degree from Southern University of New Orleans. Mr. Batiste is a licensed master social worker currently employed with the Louisiana Department of Health as the statewide social worker, providing supervision to all of the regional social workers that are located throughout the state. So these are our panelists. They are going to help us have a brief but deeper discussion. As we start this discussion, it is important that we emphasize that COVID is not over. We have to continue to remain aware and vigilant on protecting ourselves, our families, our communities. And that's with all of the things that we've been talking about for a long time now, which is masking up, continuing social distancing when possible, washing our hands, sanitizing our hands when we can't wash them, and of course, getting vaccinated. So we'll just go ahead and get started with the panel discussion. This panel discussion will be factual, be based in science and understanding. And I also want to say that as the moderator of this session, that people have a right to feel what they feel regarding their past and present experiences of potentially racism, of sexism, of mistreatment, of injustice. These things are real and they play a part in people and our populations and our communities' hesitancy about vaccines and really about medical care. So hopefully you will leave today's conversation with answers to some questions about vaccinating yourselves and your children against COVID, among other things. So let's go ahead and get started. So the first panel discussion question is going to be for all of our panelists, and so each of us will be able to answer, and we'll start with, what is your profession, and tell us how it is related to immunizations. And we can start with Dr. Rancheri.
I'm John Rancheri. I'm a pediatric infectious disease specialist. So when I'm taking care of patients, my time is in the hospital or in clinics, taking care of children with severe or unusual infections. That may be deep infections in the bone or meningitis, complicated infections that are life-threatening or in the intensive care unit. And then I spend probably more than half of my time in research and other endeavors related to COVID and other infectious diseases. Staph aureus and other bacterial pathogens are studied in my laboratory. And I direct our COVID response team in Northwest Louisiana, working closely with public health. Our teams have delivered over 125,000 doses of COVID vaccine. We've delivered close to 100 doses now of monkeypox vaccine, also flu vaccine, and this is all in community outreach, either drive-through or school-based vaccination regimens. So I'm a passionate pro-vaccine physician and an educator at heart. So that's where I am.
Wonderful, thank you so much. We can go to Ms. Davis next.
Hi, everyone. My name is Javon Davis Charles. I am the Operations Manager of the Louisiana Office of Public Health Immunization Program. I am pretty new to this role. I have been here for about 8 months now, and time flies by when you're having fun and you're very busy. So within our unit, we have the Vaccines for Children's program. So as was shared on the slide earlier, a lot of VFC is for children who may not be able to afford vaccinations if they were not getting vaccinated through this program. We also have a 317 adult program where we don't have as much funding, but we can provide vaccinations to adults as well. We are responsible for ordering vaccine and making sure that it's shipped out to providers all over the state of Louisiana. We do a lot with COVID as far as shipping out doses and tracking it. We also have COVID strike teams, as Dr. Rancheri mentioned, that do vaccination events all over the state. So we do a lot of monitoring for that. Our latest, which ties into our vaccine preventable disease outbreak response, is of course monkeypox. So we have been very, very busy with the response and getting vaccine out to populations all over Louisiana, and making sure that we approach vaccination for monkeypox with the Jynneos vaccine with the health equity lens, and making sure people who are in need are getting the vaccine. And that's a lot of tracking and follow-up as well. And we also have an adult immunization coordinator who's ramping up things such as flu and HPV and other adult vaccinations for persons who, well, really for everyone, because it's not just for children. Everyone should be getting vaccinated, and there are recommendations that we'll talk about throughout the lifespan. So that is pretty much my role, and hi, everyone. I'm happy to be here.
Wonderful, thank you, Javon. Can we go to Mr. Batiste next?
Good evening. This is Brad Baptiste. I am the statewide social worker for the Louisiana Department of Health, and I am working through the COVID-19 Health Disparities Grant, where we're trying to educate the population, not only educate the population, but also provide resources and services where the public can be aware of, let me bring that back, be educated and aware of the services that are provided within their communities, within the regions, and within the state. We also provide vaccine events, and we also partner with all local, regional agencies to provide that information, putting out educated information, putting out factual information that the public can be very educated about and bring a good awareness to all the vaccines, to all the information that we have and related to health disparities and to decrease those health disparities.
Wonderful, thank you. So my next question is going to go to Dr. Vancheri, and we're going to go on a little history lesson. So can you talk a little bit about why vaccines were created and how they work to protect us against diseases?
Sure. So vaccines have been used actually for more than 200 years. We've had some forms of vaccines. The earliest go back to smallpox, and cowpox was used as a smallpox vaccine. And the concept of vaccines is to educate our immune system about a particular germ so that if the germ comes around, our immune system, our infection fighting cells already know how to take care of it, already know how to protect us, can be defensive rather than being sabotaged by the germ. So I like to think about vaccines as kind of like a fire drill for your immune system. You know, when we were kids in school, the fire alarm went off, we knew it was a fire drill, we'd line up, we'd go left, right, out the door, down the stairs and out and meet in a certain area, and the teacher would take attendance. And the same is true with vaccines, that a vaccine is like a fire drill for your immune system. It tells your immune system what to do in the event that that germ of interest shows up on your doorstep or in your lungs or in any parts of your body. So I also kind of like to use the analogy that, getting vaccinated is like wearing a bicycle helmet or like wearing a seatbelt. It's something you do in advance. You don't put on a helmet after you crash. You don't put on a seatbelt after you crash. Those things protect you in the event that you do have a crash. And just because you're not wearing a seatbelt doesn't mean you're gonna crash. But if you have a seatbelt on, you're better protected and you're less likely to have severe injury. And the same is exactly true with vaccines. They're not perfect. They have one job, that is to help protect us. And none of them work 100%, but they do very, very well at preventing major diseases that most folks younger than me in their 40s, 50s, 40s, 30s and beyond have never seen before. Most people in the United States have never seen measles, and a lot of folks now have never seen chickenpox. And those are things that we've nearly eradicated, in addition to some really bad germs that cause meningitis and death in infancy. And so vaccines are one of the two major public health measures of the past century that have really saved lives in the United States and in the world, really have increased our life expectancy more than any other single intervention that we've done in the medical field. So vaccines are a real important part of our armamentarium against infections.
So just as a follow-up, Dr. Vancheri, you mentioned a few diseases that were almost eradicated due to vaccines. Are there any diseases that have been fully eradicated due to vaccines?
Yeah, so smallpox is declared eradicated. There are only 2 laboratories in the world that still have a small amount of smallpox in case we need it to study it, because it's a very complex virus that we didn't fully study with modern techniques, but we eradicated it using vaccines. The polio virus is also nearly eradicated. And unfortunately, you may have seen a little bit about that in the news recently because of a case of polio in New York and also one in Israel. There are only 2 countries in the world that still have polio, wild type polio, we call it, the natural polio virus circulating, and those are Pakistan and Afghanistan. And of course, that reminds us that any political tumult and turnover, especially in underdeveloped countries and redeveloping countries, can set back those public health measures. And so we're very concerned about those countries that have had success, but now are losing ground with their vaccine strategies. But those are the big 2. Measles, 15 years ago, measles killed 10 million children each year. Now it's down to 200, 250,000 each year. So we've made tremendous strides worldwide with our vaccines, saving lives.
Sure, thank you. Next, we're going to go to Ms. Davis. And can you tell us a little bit about some common vaccines that children receive, and what about adults?
Okay, I'm sorry. Can you repeat it? My Wi-Fi, my internet in here is a little wonky. You went out just a little bit. I'm sorry.
Sure. So what are some common vaccines that children tend to receive, and what about adults?
Okay, so for children, what's recommended, most of them are recommended before kids turn 2. So that's hepatitis A, hepatitis B, and hepatitis B is very important because it can be transmitted perinatally. So it is something that's recommended for pregnant women and for infants. So there's the measles, mumps, and rubella. There's also polio. So as Dr. Venturi was saying, a lot of these things were things that made kids very, very sick, even caused death, years ago. But now that we have these vaccination scheduled, we see these diseases that are practically eradicated that we hardly see anymore. So we call it the 7 series, which is pretty much the ones that I told you about. Pneumococcal is one of them. DTaP or Tdap and DTaP, because that one is diphtheria, pertussis, and also tetanus. So those are recommended before 2, and there's also a follow-up in older kids where they get it in a little bit of a different series combination. So it's called Tdap, but it's pretty much a follow-up of that vaccine. And we also recommend that kids get the flu vaccine because it is very effective for kids and can help them from being very sick. So speaking of flu, that's also one of our big pushes to make sure adults are getting flu vaccines because it can cut illness up to 40 to 60%. So flu is one of those illnesses where we see more vaccinations occurring when it's like a very, very active flu season. People get really nervous and, they'll go and get their flu shot. But post-COVID, our rates have really dropped a lot. So we put a lot of emphasis on making sure people still know the importance of getting flu vaccine, especially people who may be immunocompromised, and especially the elderly. And there's also HPV, which is recommended for teens up to early adults. And when we say early adults, that's to age 26. It can be recommended a little bit later, up to 44, depending on risk factors. There's also hepatitis B, which is a follow-up to the childhood series, but sometimes it's recommended for people who are higher risk, like people who are incarcerated or share needles. They may have a different recommendation for hepatitis B. And zoster and the pneumococcal is also recommended for persons over the age of 50. So vaccinations are important throughout the lifespan, and we really do like to encourage providers to screen their patients and make sure that they're recommending vaccinations based on the vaccination schedule, not just to focus on kids, but making sure that adults are also getting the coverage that they need.
Great, thank you. Our next question will be for Mr. Batiste, and tell us a little bit about vaccine hesitancy. We've all heard these words. We hear about vaccine hesitancy all the time, but I really want to understand what it is and what it looks like in our communities.
What it is a delay or an acceptance in terms of vaccinations. What it looks like, let me say what it sounds like. You usually hear, and I hear this from my own family members, I'm not going to get that shot. I'm not going to get that vaccination. But what it looks like is an underutilization of services. We have dozens of areas that provide vaccinations, but because of the unknown, because of the lack of understanding or the lack of knowledge in reference to those, they underutilize the service. So it seems to be a hesitancy, but it could be more of a lack of awareness and education of what those vaccines can provide for them.
So, what factors do you think contribute to people who are vaccine hesitant?
Again, just the fear of the unknown, the unawareness of what the vaccines provide, what they can do, what they allow us to be able to accomplish in terms of vaccinating ourselves, preventing those diseases that basically, like everyone else kind of said, have been eradicated. But being aware of those vaccines, the other factors are age. As we saw, COVID kind of did a number on our elderly population, but it also ran rampant in our other age ranges. So you look at age, you look at the environment in which people live in, you look at socioeconomic statuses, all those come into factor when that comes into talking about vaccine hesitancy.
Sure. You talk about fear, and I do hear that often. Ms. Davis, can you talk a little bit about safety of vaccines? And, people always ask the question, are vaccines safe?
Yes, definitely. So vaccines go through a pretty rigorous amount of trials and safety tests through the FDA. So before they can be approved, they have to go through numerous safety trials, and the FDA ends up giving like the final and last approval saying that yes, this is safe. So even after vaccines are approved, we still monitor them from our program to make sure that they're, and that's to say to make sure there are no adverse reactions, because as Dr. Venturi mentioned, they're not perfect, and sometimes there will be an adverse reaction, sometimes just because it may not agree with the person, that got it, or maybe it might leave a red mark or some swelling or things like that. So we do have a process in place where we have an adverse reaction reporting form. So we strongly encourage providers to where there is an adverse reaction to please report that to our program so we can report it to CDC. And what happens is they will do additional follow-up just to see if something that happened that may be out of the ordinary, or if they think that there is a potential problem with the vaccine. So it's not like, it's approved and it's out there and that's it. There still is continuous monitoring that's done through the immunization program and working with CDC so they can continuously monitor and follow up with adverse events.
And Dr. Kavanaugh, I'll add to that, our vaccines are continually being looked at for improving safety. If you look back 10 years, we used a pertussis vaccine that caused a lot of arm swelling and a significant amount of reactogenicity, we call it, a lot of fever, arm swelling, soreness, those kind of things. And so we now use a different pertussis vaccine that only has the 3 or 4 components that are necessary to give a good protective immune response, to educate our immune system about how to fight pertussis. And consequently, it has much fewer side effects, not nearly as much fever, arm swelling, and the other things as the prior vaccine we used to use. Same is true with our shingles vaccine for adults. The shingles vaccine that was available up until a few years ago, just 2 or 3 years ago, was an okay vaccine. It gave you about 50% protection, but the new shingles vaccine that's available with a different technology is now over 90% effective. Really, really important, big boost in effectiveness without compromising safety. And so this is a continual process. For flu, as mentioned, we know we need better flu vaccines. And that's been a struggle for decades. We've been using flu vaccines for over 50 years, but the ones we have are only okay. They're, sort of a B- or a C+ kind of vaccine in terms of their effectiveness. And so scientists are continually working, and physicians in the laboratories to make better vaccines and safer vaccines for us.
Yeah, it definitely sounds like there's been some great strides. I actually have a follow-up question for you, Dr. Venturi, kind of related to this topic. I often hear parents who come into the clinic who are concerned about giving all of the vaccines at one time. So they want to delay vaccines, or they want to wait until right before they start school to start those vaccine series. So can you talk a little bit about why we start vaccine series so early and why it's important not to push it off?
Right. So there are several factors that play into the schedule of the vaccines and when we schedule those and how we use them. One of the most important is that when the clinical trials are conducted, the studies that go to the FDA to seek approval based on effectiveness and safety, those are done on a very rigorous schedule. So for instance, our diphtheria, tetanus, and pertussis vaccine is 2, 4, and 6 months. In Europe, they use it at 1, 3, and 5 months. But that's the difference is because that's the way the studies were done in the United States, 2, 4, and 6 months, and they are 1, 3, and 5 months. They're both okay, but we use what we're comfortable with. That was the studies that were done in the United States. So one is, how are the studies done? The second is about risk and how your risk changes as you grow and your life changes. So for instance, with the HPV vaccine, we actually know that that vaccine is most effective, gives you the best immune response if you give it to children who are 4, 5, and 6 years old. But it's approved for age 10 and up.
Have we frozen?
I think we are frozen. But until Dr. Venturi unfreezes, I guess I can also add a little bit to the discussion. So our program, especially within our communications unit, had also been looking closer at childhood vaccinations and some of the reasons why parents are saying that they're uncomfortable, or like you said, that's one that we hear a lot too. They feel uncomfortable with giving them so many at once, or within a 2-month time frame. And what we found was that it's typically 3 groups that were represented in the focus group. One group were like, yep, we do everything that our provider recommends. We believe in vaccinations, and they're very gung-ho about it. There's one group that was also just very, very against it, doesn't trust it, like, no, we don't really know where this information comes from. But then there was a third group who were kind of on the fence. They may get some information from social media, so it makes them a bit hesitant, but they also are trusting in their provider. So they're like, well, maybe maybe I'm comfortable with giving it to them within this time frame, but not so many at once. So for a lot of our outreach, that really was the group that we decided to focus on, of just letting them know what the facts are and what the safety is, because it is like we talked about, it is a lot of misinformation out there. It is a lot of people who didn't grow up in times where, there's polio and everywhere, and chickenpox. When I was little, we had chickenpox, but so now we have a generation who may have not seen those things. So those, people who might be on the fence, might listen to their providers, might listen to social media, has been the group that we've been targeting to try to push information and education to. And I see Dr. Venturi is back.
Sorry, I lost you. So just 2 final points on that. One is that, if we give some vaccines too early, like the measles vaccine, mom's immune response that's transferred to the baby actually can interfere with the vaccine. So we use measles vaccine in the United States at 12 months. It's okay as early as 9 months. But before that, mom's immune response, mom's antibodies actually would interfere with the take of the vaccine. And then the last thing is, and I get this question about, well, there's so many different vaccines all at the same time, it overwhelms our immune system. The fact is, it doesn't. Our infection fighting cells, our immune systems are exposed to thousands of different things every day. And so 5, 6, 7 different vaccines at one time is nothing for our immune system. It's trivial for our immune system. And our immune system has very good sensitivity and specificity to distinguish between those germs. And we prove every time that just because you combine 7 or 10 or even 15 for some of the vaccines, the immune system can recognize each one of those and mount a great immune response. So our immune system is just a fantastic part of our body that has tremendous capability.
Yes, it is an amazing thing for sure. My next question is for Mr. Baptiste. So I know people sometimes wonder, and our audience may be wondering, if I'm out in the community, how can I protect myself? How can I protect my family and my friends from these diseases that we're talking about?
Uh, Simply by getting vaccinated, making sure that you're vaccinated currently right now. Make sure that we are vaccinated with COVID. Make sure we having our boosters. Make sure that our children are up to date with their immunizations. School currently opened up in pretty much every district, and I know just by having a child within the school district, I'll probably be receiving a letter saying, "Is your child up to date with his or her immunizations?" So by making sure that those immunizations are up to date, getting out vaccinations, like I said, like for COVID, for the flu, pneumonia, and just following the CDC guidelines as well as LDH's guidelines on taking care of ourselves.
Great. So the next question is kind of just general for all of our panelists. Can any of you talk about some ways that our healthcare community is attempting to educate people on vaccines? We can go in any order.
Hey, I was just going to mention some of the work that we did with the focus groups, our communications. I won't call it a unit, but I guess it's a little unit. The purpose of it is to create materials, billboards, pamphlets, for shots, for tots, educational things that can be pushed out to providers. So that really is, that really was the purpose of a lot of those focus groups, just to kind of gain better understanding of what, you know, what the barriers may be. And I thought I might have something that I can share. It might take me a minute, so I'll let someone else go.
Currently with the COVID and health disparities grant, we're pushing out information constantly. We're trying to educate the public about all the resources that they have, and especially partnering with all the local agencies that are within the communities, that are familiar with the communities and have a relationship with the communities. That's one of the biggest things that I think we can actually have, is a relationship with the people in the communities. That way they feel trusted and trust us to provide them with information that will actually help them out within their daily lives.
It's been a real challenge in some of these areas of where there is a lack of trust. And, you know, I know a lot of the history of where that mistrust comes from, and I would give anything to be able to change that, but I can't. And a very prominent pastor here in our community said that if I want to be trusted, I need to be found trustworthy. And I really take that to heart, and because I think that's critically important across all of our spectrum in life and all the things we do. And so I try to be found trustworthy and provide a consistent message and answer questions and be very comfortable saying, you know, there's some things I don't know. I'll do my best to find the answer. There are some things that are just not known yet that we need better answers to. But that's difficult to build trust over time, because the if you want to call it the sins of the past that we all have inherited are problematic, and our memories are long for those, and it takes time, and so I'm very passionate about that. Try to be very patient about that as well, and encourage providers when a parent, you know, doesn't want to vaccinate their child. Just remember that our goal is the same as their goal, the health and well-being of their child. We have that in common, and we can build that alliance and help parents understand that our goal is actually the same as theirs. We may disagree a little bit at times on how that is done, whether we require a child to wear a bike helmet or not, or a seatbelt or a car seat, you know, all these different things, or vaccines. But our goal is the same: the health and well-being of our children, health and well-being of our grandparents and parents are all part of that whole message that we have to convey.
Sure. You know, I find that it's very sometimes difficult to breach the topic of vaccinations in today's age with family members, with friends. You know, you try to talk to folks about it and they don't want to hear it. So any advice from our panelists on, you know, how to how to talk to family or friends or coworkers who might be hesitant about receiving vaccines?
I can start this time. So it can be a charged conversation. And, we always have said in the past at Thanksgiving, don't talk about religion and politics. Well, vaccines is right up there, for a lot of families. And again, I think part of it is patience. It's being understanding, being willing to answer questions and admit that you don't know all the answers, but that we are looking for the same outcome, the health and well-being of our children, of all of our family, and that vaccines are not perfect. They're never going to be perfect. Medications aren't perfect. They have side effects. Heck, none of us is perfect, right? And so that's just part of our world. There is not perfection in our world, and understanding that and being accepting of that helps us to each individually balance out our acceptance of risk and benefit. It's like people don't like wearing masks. Well, if you wear a mask, it reduces risk. If you don't wear a mask, your risk is different. Look at the environment you're in. If you go to a concert with 20, 30,000 people, a lot of people there with COVID or flu or other germs and things. So wearing a mask would reduce your risk of getting those things. And you might accept the fact that you're going to feel socially awkward because you're wearing a mask. But some people won't, and that's where they are. They make their own decisions. And my wife's a social worker, so I get a lot of this.
For me, I believe it's just providing that information, being able to listen to the other person's perspective on it, but also providing that educated information and allowing that person or those persons to have that self-determination to believe what they want to believe or make decisions based on what their principles are. Sometimes it's with religion, sometimes it's just because of old traditions, but we have to be respectful of that, like Dr. Van Cherry said, but just provide that information no matter what.
Yeah, and I would say the same. And actually, it's funny hearing Dr. Venturi describe it, because that was the same way my primary care provider described it to me, of how to encourage friends and families to get vaccinated for COVID. That it is a risk versus benefit, and that was just what I started to say. If you're around 10 people and 5 are vaccinated and 5 are not, and you're one of them who's not, you'll probably get sicker if you catch COVID. So it just increases your chances of not just getting COVID, but also getting sicker from COVID. So I think it kind of spins people's wheels a bit when they think about it, like being in a group setting and what their risk really is. And even if they don't agree, as Brad said, you just have to respect it. But it may be something that you said that kind of keeps their wheels spinning a bit. And if the opportunity presents itself in the future, they might be a little bit more willing to say, yes, I'll go ahead and take, and get my flu shot or whatever this year than to say no. So, we can only do what we can.
So all of you spoke to some degree about, risks or risk versus benefit. And, obviously for different diseases, the risks are, different. So can we talk a little bit in general about factors that may increase risk of severe outcomes from infectious diseases? So what things make you high risk?
So it does vary a little bit, for each different germ, but in general, someone who has chronic illness of liver, kidney, heart, lungs will be at higher risk for bad outcomes. There are some patients with underlying conditions like sickle cell disease that have higher risk of bad outcomes with particular bacteria. There are immune compromised patients who've gotten organ transplants, either or on cancer chemotherapy that reduce the effectiveness of their immune system because of those treatments and consequently increase their risk of bad outcomes. And we also know that age is a prime factor at the extremes of age, the very young babies who don't have a mature immune system yet, and older folks over age 65, 70, the immune system begins to wane in its ability to respond effectively. And so the risk of, say, for instance, invasive pneumococcal disease, that pneumonia vaccine that we use, is highest In little babies, it's about 15 cases per 100,000 per year. But in folks over age 85, it's more like 40 to 50 cases per 100,000 per year. So 3 times the rate as it is in infants. And so those are the major factors that change risk. Environment, lifestyle, and work environment especially can also increase your risk in different scenarios.
In addition to that, I believe that access to healthcare is also very important. We look at some of the insurance issues. We look at transportation. Just by being able to not being able to get to a facility to access that healthcare, that is definitely also a big detraction in reference to accessing healthcare.
Well said.
Sure.
Yeah, agreed.
Sure. All right. So if people who are watching today have more questions about themselves or to answer questions from their family members, can each of you talk about, where you go for reliable information about vaccines?
I go to the CDC website all day long. And part of it is just because of the role of my particular job. That is where I feel like is the factual information. Unfortunately, I know that some people just aren't trusting of what's out there. So I feel like I don't really have a good answer, because I do think that we should rely on our state health officials, our federal health officials for information that has been researched and vetted, by professionals and by people who've been studying for a long time. So that is where I go, to get information, to get answers, and I'll let anyone else recommend anything else.
So we've done surveys in the state of Louisiana, and others have as well, and in other parts of the country. And the absolute most trusted source for healthcare information is your own doctor. And that may be a nurse practitioner, your own healthcare provider on a regular basis. And in the ideal, that's a person that we have a long-term relationship with, that we see a couple of times a year for our checkups. We go when we see them when we're sick, and they know us, they know our health situation. And because of that that relationship is the foundation for trust in that situation. As Mr. Batiste pointed out, access to care is a big inhibitor of having that constant source of trusted information. And so I try to remind folks, Dr. Google didn't go to medical school, and just because you find it on the internet doesn't mean it's right. It might be, but you really have to look at those sources on the internet and find reliable sources of healthcare information on the internet. But the ideal is that every one of us has a primary care provider that we know and knows us and has our records at their fingertips if they need them in the middle of the night, via computer, all those things. But we're far from that. We've got a long ways to go to have equity and access for all the citizens of Louisiana, and we're working on it.
Totally agree with you, Dr. Van Cherry. Our primary care physicians know us like the back of their hands, as we say, but we also have the Louisiana Department of Health's website, also the CDC as well. But in today's generation of society, we also have social media. But again, you have to be careful of that information that is put on social media. We want to be cognizant and aware of everything that's going on, but everything that's put out there is not factual. So please rely on those sources that are providing factual information.
Wonderful.
Yeah, in our survey, the least trusted source for health information was actually social media, which is good. And that means trusted source. That doesn't mean people aren't looking at it, but do they trust it? And people are skeptical of it. So that's people are paying attention.
That's good. Fantastic. So, we're sort of getting closer to the end of our time together. So I want to make sure we give each of our panelists time to sort of maybe provide us with kind of some words of wisdom. Is there anything else that you really want folks to take away from this session today that you want to summarize for us?
I'll start.
All right.
I think just by being aware of all the services that are in your areas, because a lot of times we really don't know what is in our area, what is provided to us. And we have to be more vigilant in providing that information to the public and to the population, because if we don't have that information, we can't use it. We're not knowledgeable about it. We're not going to use it. So to be able to put that information out, to have access to that information, I think is one of the biggest things. And also we cannot stress that trust factor. You have to be able to have that trust. So once we have that trust when our population and our communities, that's when we'll have more information that's put out and more trust from the things that we do put out.
And I would just say that vaccines are still important. There's still vaccine preventable diseases around us that are growing and seeping through because we've had some decreases in, childhood and adult vaccination rates. So for individuals, if you can talk to your provider about what vaccines that you may be eligible for, what vaccines they think that you need based on your personal risk factors, based on your history, staying up to date with flu, that is very important. And for providers, we really trust in them to give a strong vaccine recommendation, and that they also go through their patient's history, talk to them about what vaccinations may be a benefit to them, and of course, staying on top of childhood recommendations and following the schedule for childhood vaccination.
Excellent. So I think my message would be, when we think about vaccine hesitancy, we're really talking about a lot of people for a lot of reasons may have questions. And having questions doesn't mean, you're against vaccines. It just means you're asking questions. You want to know more. You want to make the best decision you can and have the information to make that. There are very few people in the state of Louisiana who are adamantly against vaccines and won't get vaccinated. Very few. That's less than 5%. They're squeaky wheels. They command a lot of publicity in the newspaper and the legislature and the like, but that's not the majority. And so there are some folks who have questions, and providers need to be ready to answer those questions or help people find answers and build the alliance with those families for the same goal, the health and well-being of their family, the children, parents, grandparents, and the like. And then, one of the basics, I'm an infectious disease doctor. One of the most important things you can still do, wash your hands. Wash your hands again. People want to talk about all these germs. Washing your hands is just basic, fundamental. Teach our kids to do that. Wear masks when flu season and respiratory virus season is really hot. Then we're going to save a lot of lives. We're going to keep a lot of kids in school, healthy kids in school, learn better. Parents can work, can do the things they need to do. You don't have vacations ruined by COVID when people show up in Hawaii and all of a sudden they test positive. All those things are just, they're a real pain. We're tired of them. But the basic things we can do to protect ourselves, the hand washing, the masks, as we've talked about, are all important strategies. And if anything we've learned in this pandemic, we've learned an awful lot about ourselves, about each other, about science. But the basics are still the fundamentals that keep us safe.
Such wise words from all of our panelists this evening. I think that concludes all of the questions that we have for all of you. I'll just say that it's definitely been a pleasure to have this conversation, and hopefully it was helpful to all of the people who were listening in today. So we appreciate each of you. So Ms. Ussery, I'm gonna go ahead and turn it back over to you.
Sounds good. Sounds good. Thank you so much. What a wonderful panel discussion. So thank you, Dr. Kavanaugh. Thank you, Dr. Bancheri. Thank you, Ms. Davis. And thank you, Mr. Batiste, for your responses and for being a part of this especially important panel discussion today. As community gatekeepers and providers participating in this discussion, each of you has helped to enrich people, populations, and communities' awareness. So again, thank you so much. I'll give my colleague a chance to pull up our key takeaways. So after that wonderful discussion, we'll just go ahead and go over those 4 facts again related to immunizations. So first, vaccinations are recommended based on an individual's age, health conditions, job, or lifestyle, just like mentioned in our discussion today. Next is vaccines work with our body's natural defense to help safely develop protection from diseases. They give us the power to protect ourselves and our children from serious diseases like measles, shingles, whooping cough, the flu, and more. Thanks to the development of these vaccines, many serious diseases are no longer common in the United States. However, these diseases do still exist and can spread when people aren't vaccinated, and that's what we're starting to see. They can also cause serious illness and/or hospitalization in certain cases. And last but not least, vaccines are safe and tested before they are shared with the community. They're also carefully monitored after being released to the community to continually ensure their safety. So these were all facts and things that were mentioned during today's panel discussion. I hope you take that with you. All right. And also I want to thank all of our attendees for coming and listening to this discussion today. I hope you found something enriching and valuable that you can take back and add to your discussions with your families and within your communities. Please utilize the resources that we will be emailing to you after today's presentation. Once more, for those of you who may have Medicaid insurance, if your medical insurance coverage is from Medicaid, then you must make sure that your information is up to date. This includes your address. If you do not update your information, you may miss important letters from Medicaid and you could lose your health insurance coverage. To update your information, you can visit the self-service portal, which is the address is on our screen. You can visit that self-service portal at www.ldh.la.gov/MyMedicaid, or you can give a call at 1-888-342-6207. At this time, I will bring in my Deputy Director of the Bureau of Community Partnerships and Health Equity to close our webinar. Mia.
Hi, thank you all again for participating in today's webinar. And before we go, I just want to thank the staff of the Bureau of Community Partnerships and Health Equity here at LDH. I want to make sure we also thank the LDH Immunization team for their help with today's webinar, and the Bureau of Media and Communications for executing such a needed conversation today. So thank you all. A huge thanks goes to the entire Louisiana Department of Health team. And last but certainly not least, a special thank you to the Secretary of the Department of Health, Dr. Courtney N. Phillips, for her continued leadership in pursuing a healthier Louisiana. Please join us for our next conversation focusing on suicide prevention on September 21st at 5 p.m. You can use the QR code on your screen or go to tinyurl.com/LDH suicide prevention web to register for our next webinar. This concludes our event. Good night and good health to you all. Thank you.